In this video, I'm going to talk about lifestyle changes that can help manage hidradenitis suppurativa or HS. If you're unfamiliar with this condition, HS is a chronic skin condition that causes painful bumps, abscesses, and tunnels under the skin, often in folded areas like the armpits, the groin, and under the breasts. While there's no cure, there's a few lifestyle changes that can really make a difference in managing symptoms and reducing flare-ups. One of the most important changes you can make is to focus on your diet. There's no specific diet that's been proven to cure HS, but many people find that certain foods can trigger flare-ups. A dairy-free diet is one of the most common dietary changes that has helped some people manage their symptoms. In a study of 47 people that went dairy-free, they found 83% of patients had improvement in their symptoms. Dairy products, especially cow's milk, can increase inflammation in the body, which might contribute to flare-ups. By cutting out milk, cheese, and other dairy products, you might notice less flare-ups and less irritation in the affected areas. If you're craving dairy alternatives, there are lots of different plant-based options like almond milk, coconut, yogurt, or dairy-free cheese. Make sure you supplement with vitamin D and calcium to get all the right nutrition. In addition to avoiding dairy, it's also helpful to focus on anti-inflammatory foods. A diet rich in leafy greens, berries, omega-3 fatty acids, which you can find in things like fish and flaxseed, can also help reduce overall inflammation and support your skin's healing process. On the other hand, processed foods like refined sugars, carbs, these can trigger inflammation, so you want to limit those and make sure you're getting a well-rounded diet. Another really great addition to your diet is actually zinc. So zinc is interesting. It's an essential mineral that has been shown to support health of the skin and reduce inflammation. So for people with HS, zinc can actually help improve wound healing and may even reduce the frequency of flare-ups. You can get zinc from a variety of different foods like pumpkin seeds, chickpeas, cashews, certain seafoods, and you can also take it in a supplement form. We typically recommend zinc gluconate, which you can usually find as either a 50 or 90 milligram tablet. Make sure you talk to your doctor though before you start any new supplements, just to make sure that it's okay for your health. Maintaining a healthy weight is another key factor. So being overweight can increase friction and sweating in areas prone to HS, and this can make flare-ups more frequent for some patients. By managing your weight through healthy eating, exercise, you can reduce the risk. Even reducing a small amount of weight has been shown to help some people reduce their symptoms and flare-ups. But it's interesting because they've actually found that some people that undergo bariatric surgery and have really rapid weight loss may actually have worsening of their HS. Another thing that you can do at home is just making sure you keep your skin nice and clean and dry. Moisture and bacteria can aggravate the condition, so it's important to keep those areas in the armpits, the groin, under the breast clean and not too wet. I usually recommend using fragrance-free soaps that are gentle to avoid irritation. Another option that has been found to be helpful for patients with HS is using an antiseptic cleanser. So something like benzoyl peroxide, 4 or 5%, or chlorhexidine, which is marketed as Hibiclens. Using these in the folded areas that tend to flare for you several times a week has been shown to help reduce flare-ups as well. Most of these can be found over the counter. We also recommend wearing nice, loose, breathable clothing. So tight clothing can trap heat, sweat, and moisture, and even just the pressure on the skin can sometimes worsen HS. So I'd recommend opting for loose-fitting clothes made of natural fibers like cotton or bamboo, which allow your skin to breathe a bit better. I also recommend that you avoid synthetic fabrics like nylon or pure polyester, because these can trap heat and moisture and sometimes increase irritation. Now, another thing that a lot of people don't like talking about but is really important for HS is smoking cessation. So smoking is another lifestyle factor that can make HS worse. Actually, research has shown that smoking can contribute to more frequent and severe flare-ups, and it can also make the condition harder to treat with our medical therapies. If you're a smoker, consider taking steps towards quitting. There's plenty of resources out there to help, and cutting out smoking can really improve your overall skin health as well as your health in general. Finally, it's really important to consult a healthcare professional. While lifestyle changes can make a big difference, working with your doctor or dermatologist is crucial in managing HS. We know it's a chronic, recurrent, scarring type of skin condition, so making sure you have either a good topical regimen or taking certain medications by mouth or even some biologic therapies can help to reduce the frequency of flare-ups. There's also surgical options and even things like laser hair removal that have been found to be beneficial. Well, that's it for this video. If you have HS and you've had some lifestyle changes that helped you, let us know in the comments section down below. I'd love to hear from your experiences. Thanks for watching, and we'll see you in the next one.